I think among the biggest priorities and the biggest things going on in the policy arena for our membership probably have to do with payment reform, MACRA, MIPS, alternative payment methods, and all these, or alternative payment models. See, my own alphabet soup is slightly off kilter, but that really impacts the way we practice. It also impacts the way skilled nursing facilities are going to be paid. We've got new payment methods coming up for them as well. You know, the rugs are going away, and so there is a lot of change in the air. And I think as we shift to more of a value-based sort of system, we have to rethink the way we do things. And I believe that it's going to turn out to be positive in the long run. Other sort of trends that we're following have to do with, you know, the perennial sort of tort reform type issues. And there's been talk about designating our work as a specialty in the way that hospitalists also did. And I think that that might be a good idea, because essentially we're being compared to outpatient, you know, primary care doctors who have a completely different population from what we take care of. And under the current MIPS, you know, evaluation system or point counting system, we're going to take a huge beating on the costs of care for our patients. So if we really want to be compared sort of apples to apples, I think specialty designation would be great.
Some of the key accomplishments, we've had a great year. We've had some both legislative and regulatory accomplishments. On the legislative side, obviously, one of the big things that occurred within the budget deal was the repeal of the therapy caps, which has been an issue for close to 2 decades. So that was a big win for post-acute and long-term care. We also worked a lot on streamlining the MACRA requirements within MIPS and got some flexibility for the next 3 years. So that the workflow is easier for clinicians practicing in this space, and the penalties for some of the programs have been reduced. So we've had a good year. We've also worked on the regulatory side to, again, try to streamline all of the different participation in the different value-based programs. So we continue to work at it, but we're pretty happy with our accomplishments as well. Clearly, clinicians are getting bombarded with a variety of acronyms, whether it's MACRA, MIPS, VBM, BPCI, and all of those things. But I think, you know, for the advice, I guess, to clinicians from a policy perspective is to really look at the big picture and still focus on what you can accomplish with good clinical care in post-acute and long-term care medicine. Right now, there's a lot of focus on reducing costs, length of stays, readmission rates, and all these things, but they can't be accomplished unless you do what you've always done, which is take good care of patients and residents in these facilities. And so I think that to pay attention to the big picture and then take it piece by piece to understand what the reporting requirements for measures are, what are the reporting requirements for some of the facility measures are, and speak with your colleagues, learn kind of a little bit about the market, whether there's accountable care organizations or what kind of other alternative payment methodologies there are. So continue to learn, but I think in general, just practice good medicine is still going to get you where you need to go.
We have a seat at the table. We're there with CMS. We have frequent communication with them, and I'd like to strengthen our bonds with other organizations, you know, American Healthcare Association, Leading Age, you know, the Consultant Pharmacist Association, NADANA, GAPNA, all those organizations, because I think when we work toward our common goals together, we are much more powerful.
And I would say to stay engaged, to stay up to date with the policies, the policy updates that we try to put out to the organization, and to engage with your colleagues and with the organization, to continue to sort of ask questions, to watch webinars. It's tough to take all of this in one sitting if you're, you know, at a meeting like the AMDA meeting or other meetings where you're just trying to take it all in an hour or so session is very difficult. But if you sort of take it piece by piece and take your time through it, and understand what's one key piece you could do. How do you prove your value in an environment that is asking you what is your value to the system? So that's just learning how to speak the quote-unquote the new language. But medicine hasn't changed. It's just adapting to the new environment.
Many thanks to our membership and our leaders for going through so many pages of Federal Register and so on to come up with really valuable comments. And CMS doesn't necessarily take everything we say and implement it, but they are listening, and they certainly have implemented some things. And we've had some significant successes in the policy and in the payment arena over these last several years, and I hope that'll be a continuing trend as we go through this period of really rapid change, kind of unprecedentedly rapid change in our industry.